morning and welcome to the 26th edition of the COVID-19 Talk with local health authorities. With me is Dr. David Persse, representing the city of Houston, Dr. Umair Shah, representing Harris County. I want to say thank you to past President Kathy Finninger of the Houston Rotary Club, and I am Stephen Williams, Director of the Houston Health Department. Okay, let's look at some of the items from last week. Any updates? The U.S. San Francisco identified a nanobody, a synthetic antibody that can block COVID as a bridge to treat patients until a vaccine is approved. Yeah. All right, you've done your homework. How does it work?
Yeah, I don't know about you, but I looked those up. So the spike protein that we keep hearing about is a protein that sticks off the outside of the coronavirus, and that's what adheres to what's known as the ACE2 receptor on a cell. And when that connection occurs, that's what allows the virus to infect the cell. Well, if you look at that spike protein, it's got like 3 little balls on the end of it. It's one protein, and actually a protein is a very long string of amino acids, and it just folds on itself. And the way it does, there's these 3 little balls, and these nanoparticles actually will attach to those little balls on the end. And when that happens, it can't connect to the ACE receptor, and therefore blocks the virus. Now, this has been shown to be effective, but it's only been done on Petri dish. It hasn't been done in anything live that I know of yet. But nevertheless, if this bears out, that would be a really neat new way to fight viruses.
Wow. Have you heard about stem cell use? You didn't do your homework, man. Have you heard?
David would.
Have you heard about stem cell use to treat COVID?
Yeah, and I looked up that one too. And so this is so stem cells, what they'll do is they'll take part of the bone marrow, and they'll get a particular type of stem cell out of a patient's bone marrow. And then when they're severely ill, with lung scarring and stuff, they're using those stem cells while the patient is critically ill to try and regrow healthy lung tissue. So it doesn't do a lot of good to do it too early, because if you've got healthy lung tissue, you don't need to repair it, and you'd just be wasting the stem cells. So they're using it, and it's, again, experimental, and it's very early, but it is showing some promise.
Yeah, I did look this one up. So it is, as David said, the regeneration piece. So it's really about that really severely affected, scarred tissue looking primarily at the lungs, because that's obviously where we have the most concerns, but it can go even elsewhere.
One of the things I found most amazing about is it does seem to be showing some promise. But remember, they're using on patients who are they're really critically ill. So for the stem cells to still be able to make an impact at that point is pretty remarkable about stem cells.
Yeah, yep, absolutely.
On transmission, starting with many losing faith in CDC, please comment on their recent findings. The CDC study found adults who test positive are twice as likely to report having eaten at a restaurant than those who test negative. Masks and distancing do not seem to help, as ventilation might be the culprit. Y'all have talked about that before.
Yeah, so look, CDC has been under an incredible amount of scrutiny. I don't envy their position. They've been caught in the middle of a lot of, unfortunately, political issues as well as public health. I think all of us have agreed that from a local standpoint, we are concerned about the marginalization of the CDC. We know there are a lot of great colleagues we have at the CDC that do a great job. They're in their own right fantastic what they do. But there are some systematic issues right now with the CDC and its perch in the federal government, and even how the organization itself is structured. And I think we can get into that in a longer way. But I think the question here is about transmission at restaurants and things like that. I looked at that, and one of the concerns or questions that I had about that was, is this because these are people that are more likely to be out anyway, right? Is there some confounding factor that they're out? If you're someone like me who right now is not doing as much of the eating out at the restaurants, then I have other behaviors that are also very protective behaviors. But if somebody is out doing certain things, are they also likely to do other things? And that may not be captured in that information. But it does bring a question about indoor versus outdoor and ventilation and those kinds of things that
I think the
are in
question
concern.
here is, do you believe the CDC when they say this? And I got 3 other ones too, and that is CDC believes school closures pose greater risk to students than COVID. CDC announced that even though deaths are rare among those under 20 with COVID, many are only brought to hospitals once they're seriously sick. Should parents be more diligent in acting upon symptoms they normally would ignore? I would guess that you would support most of this.
Yeah, it sort of depends. I'm taking a lot of what the CDC says with a grain of salt. If it sounds like it's a policy decision or something that's heavily influencing policy, I'm going to go to the raw data from the peer-reviewed journal that wasn't,
That's right.
you know, now the CDC does a lot of their own research, right? And so how that's being interpreted right now is, you know, I'm being very careful.
I think we have to, you know, Stephen, is that, you know, I wish this were different times where we could say, CDC puts something out, bam, you go 100% with it. Now we have to really ask those questions about it, unfortunately.
So one of the things that, to your example about with the restaurants, one of the things that the crimes, if you will, if I can use that strong of a term, is that we look to the CDC to do the studies like you talked about the restaurants and recognize those confounding variables and having the depth of an organization to be able to evaluate for those. Whereas the university of wherever may not have the depth and the power and the manpower to do a study well designed enough and executed to account for those sorts of things. So we really do need the CDC to be operating at 100% right now.
According to WHO, World Health Organization, deaths are expected to rise sharply in October and November. Why?
Well, I think a couple reasons. At least in the northern hemisphere, it's because it's, you know, the weather's going to change. And we're going to be spending more time indoors, less outdoor activities, and so that's exactly what the virus takes advantage of. And so
That's right.
that's the fear of that projection.
The other thing is that with the WHO, the way that they're looking at these, you know, these projections, it's global projections, and some of the global projections are really also about, look, we've been at local level, look, we're fatigued after 8 months of this. When you go to resource-poor countries who have already been trying to stand up systems for several months at a time, sometimes the sustainability is just not going to be there, and so that's also an issue.
Thank you for joining our COVID-19 talk with local health authorities. We'll be right back. Y'all getting our intellectual.
Respond to the upcoming 2020 Census survey online, by phone, or by mail. A complete count of all Houstonians helps our city secure federal dollars for roads, schools, healthcare, housing, and disaster recovery. By answering just 9 questions, your voice will help shape how Houston is represented by state and federal officials over the next 10 years. The census is easy and everyone counts. Your responses are safe and confidential. For more information, please visit 2020census.gov.
With coronavirus spreading, people at higher risk must take extra precautions. You're at higher risk if you're over 65 or if you have an underlying medical condition. Please visit coronavirus.gov for more information.
Now. Wash hands now. Wash hands now. Wash hands now. Hand washing is one of the best ways to stay healthy all year long.
My grandma always says everyone counts, and everyone who lives with us is special. Like my aunt, who took me on my first bus ride to the library, or my older cousin, who walked me to my first day of school, even my mom's friend and her baby who live with us.
The census informs funding for schools, roads, healthcare, and more. So count everyone in your home, including all children on the 2020 census. It's your chance to help them for the next 10 years. You can respond online, by phone, or by mail. Shape your future. Start here. Learn more at 2020census.gov.
Welcome back to COVID-19 Talk with our local health authorities. Dr. Persse said colleges and universities should try to isolate infected students instead of sending them home. what would this have to look like to work?
Well, I don't work at a university, but the thought is that instead of sending the homes to go infect their families, if you keep the students there, it's a form of quarantine. And you got those, isolation for those that you know, and quarantine for those who might. That's our bread and butter public health protection level.
That's right. I mean, there's dormitories and other, domiciles that obviously college students are part of as well. I think the thought is to try to keep things going for as long as you can and not necessarily continue the spread to others as well.
Okay. Halloween is approaching. At least masks won't be a problem, but what should parents consider when sending their kids out in the neighborhoods? And what should we do to ensure our own safety?
Yeah, this is, for me, and I don't know, David, how you feel, but for me, this is about a week away. Or a couple weeks away that, we've talked internally about what would Halloween look like, and my answer has been, gosh, that's in October, the end of October, where we're still trying to figure out what's happening in the next couple of weeks. But in seriousness, there are a lot of folks that are making plans already for it, and we really don't know at this point what's going to look like, because obviously things are getting better, which is good. We don't want things to get worse because of Halloween. It's not just the trick-or-treating part, which has its own issues, but it's also the gathering of people and parties and things of that nature. That's where the concern comes in. So yeah, I like the question or the comment, the prefacing comment about the wearing of the mask. Yeah, that's great, but it's got to be the right mask, and so those things. But we have not, Harris County Public Health have not actually, dived into, I'm not sure if I'm saying it correctly, but we haven't really put as much consideration into this yet, and I'm sure we're going to work with you guys to do that in the next several weeks.
But wouldn't the advice be the same?
Wouldn't what?
The advice that you give to the public be the same?
Yeah, I think that it is consistent. So what I'm thinking about this has been, if you're going to take your kids out and you're going to go trick-or-treating, and you go to the neighbor's house and they put the candy bars or whatever, they do it so there's some social distancing, that wouldn't be too big of a deal. It's going to be the parties. That's where the wheels are going to come off.
Yeah, the part where, for our kids, where it comes in is that, when things come into our home, my wife is very good about disinfecting and, so now you get all the stuff that's in it. So how are you going to dump it? Remember, it used to be when we were younger, there was that whole thing about dump it out and you got to really check the candy to make it. So we still want that. But do you disinfect it? Those are the kinds of things that we have to be thinking about.
I always noticed great variability when one uncle of mine was over at Halloween checking the candy and how much of it was, oh, this is not good. Oh, this looks like it's been tampered with. Oh, well, wait a minute.
You did that to me a couple times, David. Come on.
Why not just go to homes you're familiar with?
Well, that's true, too. And this is the kind of guidance that, we are going to need to really be thinking, because the question a lot of people have is are you going to say no trick-or-treating, no Halloween? The answer is we're not. One, we hope we don't have to say that, but we don't know yet because we're still working through what those
recommendations are. So here's the other thing I read, and I don't know, but somebody fact-checked me on this, but I read that Los Angeles County sort of said that there's going to be no Halloween this year. And I'm thinking, oh, good luck enforcing that.
Yeah.
That's right.
Okay, well, there is a Halloween.
Yeah.
Experts at University of Washington's Institute of Health Metrics and Evaluation Project note, if 95% of Americans wore masks, more than 120,000 lives could be saved by January. Your thoughts?
I agree. I mean, I think masks are an incredibly important tool to fight this pandemic, and it will, by the way, still be in play even after we have vaccine. And so that's something, and we've also talked about that if you have national mask wearing, that also, if I remember correctly, it was Goldman Sachs that did a study where if it was, they had projected that if there was a national mask mandate that it would save the GDP 5%. So there was an economic argument as well. So there is, because masks work, I mean, at the end of the day.
Yeah, I don't know about the math particularly, but I agree with the concept. The GDP would be, say, 5%.
That's right.
Wow, that's huge.
Okay, a familiar name. Baylor's Dr. Paul Kloutman said we're probably looking at 6 to 12 months at least of mask wearing and lots of no handshaking. Do you think this will be mandated or just suggested?
Well, I think we've been saying, recommendation. I mean, we can't say no handshaking as a requirement. I mean, we could say it. I'm not sure people are going to really follow
I wonder if that's referring to the governor's order about wearing masks.
Well, the masks, yes. I was thinking about the handshake part.
Yeah. So the question is, I hear that question, what I'm hearing is the governor going to keep the mask order in place for another year? And I don't know.
Yeah.
Should he?
If we continue to have people getting sick in the hospital and dying, yeah.
I mean, so for me, it's like when you continue to require masks, what it does is it keeps your baseline rate down, right? It does that. So if you say no masks, now you do this, and then on top of that, you have flu season or you have second wave. And all. So if you keep this down, that helps everything stay calm. But then it makes it, hard for everybody.
This is the way I look
on the
at
other
it.
hand, but we have to do it. This is the kind of stuff that really is going to fight this pandemic.
This is the way I look at it. Wearing a mask is not that big of a deal, right? I mean, it's completely different, but it's been months now. It's routine for me. It's routine for most of us. It doesn't hurt. It's not that big of a deal. We've now got people wearing fashion masks. I mean, it's a tiny price for us to pay as individuals and as a community. Yesterday, we had a memorial service for a 45-year-old firefighter, father of 3 young girls. He died from this virus. So right now, today, I'm a little sensitive to people who don't want to wear a mask.
Yeah.
I read that athletes who are returning after COVID should receive cardiac assessment first. What is the protocol you have advised in Houston? Should this be something we encourage for school-age athletes?
So I think that we need to get a little more research. Some of the early research looking at people who had cardiac symptoms suggested that there was only one study I looked at, but it was a well-done study, and it showed a really high percent. I don't want to quote the percent because I'm not sure, because it was a couple weeks ago I read it, that had scars, myocardial scarring. And I think that that's one study, and we need to repeat that and find out what the prevalence is of damage to the heart, particularly amongst, if we're going to be talking about high school and college and professional athletes, and find out what that is, dig into that, because perhaps we do need to look at that.
Okay, some religious groups have been anti-vaxxers even for measles. What is being done to engage those religious leaders in our area?
Well, I know that we've had ongoing discussions with faith leaders, and I know you're all working with faith leaders, and I think it's on a weekly basis as well, calls, and I know Greater Houston Partnership convenes faith leaders. So we've had discussions and ongoing discussions with faith leaders. So I think the challenge isn't necessarily the faith leaders, it's really the people who are that are following that religion or that faith who come with here's what we're going to do or not do. And I think that's been the real challenge for us.
Thank you for joining COVID-19 Talks with local health authorities. We'll be right back.
We are in this together now. Now we have the tools to overcome this challenge. Social distance, wash your hands, get tested, and wear a mask. And we will, I have no doubts, because I believe in we, better together.
You told me not to talk to strangers. You told me not to cross the street without looking both ways.
You told me not to touch the stove.
You told me not to do drugs.
You told me not to drink and drive.
You gave me so many messages about how to stay safe. Why didn't you keep me safe by properly storing your gun?
Hello, Houston. Now more than ever, communication with our neighbors is critical as we work together to prevent the spread of COVID-19. It's important to get updates about resources, testing, and safety practices. Sign up for neighborhood updates to receive automated voice and text messages in English and Spanish. This new resource is available for anyone interested in receiving messages without needing a smartphone or access to the internet, especially our seniors. To subscribe to neighborhood updates, call 311 today and enroll.
Welcome back to COVID-19 Talks with local health authorities. This is sponsored by the Rotary Club of Houston. When we can finally get a vaccine, will we need to agree to be tracked? My neighbor seriously believes that vaccine will be able to do this and said she will refuse to take it. Many on social media are weighing in strongly and encouraging others to refuse. Vaccine doesn't come with a chip, does it?
No. A lot of myths and rumors and misinformation out there, and no, that's not what a vaccine's all about. Vaccine's about getting something to help you prevent this disease, and it's not about tracking.
Yeah, people aren't getting chipped like a dog or anything. No.
Let's hope not. No, that's not the case. AstraZeneca has partially started COVID vaccine trials. How do you partially do that? You remember they stopped because there was an adverse...
the transverse myelitis case.
Right. They had interrupted in the UK for a week, I believe, and then they came back, and I think they were going a little bit slower. That's what I think the partial piece
I don't
was,
specifically know, but I don't know if with this vaccine, if there's a 1 or 2 dose vaccine, but when you stop administering. Now you continue to track people, obviously. And then how do you partially start? I mean, I don't know if there's just fewer number of people that are being enrolled, or I don't know specifically in that case.
Okay. From the German Federal Health Minister, Jens Spahn, vaccines would not be available until they have been proven safe after extensive testing. Since we're hurrying, how long is extensive?
Well, I think that's the same thing, is that we've talked about that the vaccine availability is not just about making it available, it's also to make sure it's safe and it's effective, right? Safe, effective, and available. So those are the three things. So we don't want to just have a vaccine that's available, regardless of when it's available. We want to make sure it's safe. We want to make sure it's effective. And until it meets those three criteria, that's when the American people, I think all of us as residents here, that's when we should really feel comfortable that it's going to help us against this pandemic.
Well, we'll consider when we talk about safe, right? So we want to make sure, so certainly there are some almost immediate possible reactions. People have an allergic reaction to anything, right? So what percent of people have a standard, regular, fully anticipatable, although not common, allergic reaction? What number is that? And then you look for the things that you didn't anticipate. So this goes back to the Guillain-Barré with the 1972, right, which was not expected, but it popped up. Well, you're not going to find that out in a week, right? That takes, you know, you need to follow for several months to find out if something like that happens, right?
That's right.
So that's part of the safety. And then the effective thing is you also have to have, you know, some people get the vaccine and some people don't. Then you have to give enough time to find out, well, this many people more got who didn't get vaccinated got the illness and this people didn't. So both of those require months.
How sure are we that pharmaceutical companies are giving us information supported by data rather than trying to impress their shareholders?
So, go ahead. Well, I was going to say, if they were to try and pull a fast one now, at this point in history, they would cause irreparable damage to the pharmaceutical industry. They would lose the faith and the trust of the public for generations.
Well, and I think this is why it's not just about the private sector, it's also about the public sector. And this is why we have to have integrity of both at the same time.
John Hopkins' article said in coming months, the next difficult step will be ensuring at least 70% of the world's 7.8 billion people receive the vaccine or develop immunity due to infection. There is no global enforcement power. What entity is looking at the disbursement of vaccine?
Well, this is where I would, I don't want to get into the politics too much, but I will say that one of the real unfortunate things that our federal government has done is this pull out or pull away from the World Health Organization, because the very entity that actually does help organize a lot of these countries around the globe for a whole host of activities, including vaccines, is the World Health Organization. And when you don't have a place there, then you don't have a voice there, and that's the challenge. But
that's exactly what I was going to say.
Yeah.
Chief Executive of Serum Institute of India suggested that a COVID vaccine may not fully reach the population of 15 billion until 2024. Even Fauci seems optimistic about at the end of the year possibility. I heard a government employee this week said to a client, "We will all end up getting COVID or will die. Please weigh in with common sense for us." Well, everybody that gets COVID don't die.
Right, and I think it was, you said 15 billion, I think that was probably referring to like maybe a 1.5, maybe a 1.
They missed it.
Yeah, India's population, yeah, something like that. But yeah, I mean, look, this is at the end of the same thing as the previous question. I mean, this is really, a lot of this chapter of this book has not been written when it comes to vaccine, what's the road ahead, not just in the U.S., but really around the globe. And there is so much that we're still learning and understanding about both the virus, but the vaccine and how it's going to interact with the virus, and then how it's going to become available to the global population. And so I think it's too early to tell, but that's exactly what we're watching right now.
Inhaled versus injected. British scientists are comparing this now. Is inhaled usually better for medications in general?
Well, I don't know that. So the question about medications. So even with our HFD with EMS, there are several medications that we give through a nasal spray. They're, for example, pain medication, very rapid onset, very good absorption. It really depends on the medication, and if we're talking about vaccines, it's going to depend on the vaccine as well. Now, one thing I anticipate that's going to happen as we get further down the road here is that people are going to come to, through the popular media, become educated. There's a whole host of different kinds of vaccines with different mechanisms and different routes of administration, each tailored to that particular science for that vaccine. So we'll wait and see. But nasal is not uncommon. It is a commonly used way to administer medications.
Okay.
Yep.
With gathering limits low, some NFL and college stadiums are opening to 25% of capacity, which is still a huge number. Your thoughts?
Yeah, so again, it's about, we've talked about this before, this is not about eliminating risk, this is trying to manage the risk. And so if you look at, and for example, even on Thursday Night Football with the Texans, when a lot of folks watched at Kansas City, they had 25% attendance. And as you looked, people were fairly well spaced out, and I thought that from what I could see on TV, they did a good job of keeping, like, family groups together, but kept them. The concern then is really the concessions, the lavatories, the crossing patterns in the hallway, where people would congregate and stuff. That's where, because I think within a big, huge stadium, 25%, you can probably keep people far enough apart. It's all the other things, getting to and from the parking lot. One of the things is that some of the some of the stadiums are sort of scheduling when people can come.
That's right.
But what about when everybody leaves? Because everybody wants to leave at the same time. That's
right.
That's right. And then the Big Ten just yesterday announced that they were doing they called it an audible. The Big Ten was going to now reinstate football in late October, which originally they were canceling the season. So again, there are going to be a lot of moving pieces that are going to be related to both professional and college sports.
Yeah.
Are we up to date on reporting backlog tests at this point to correct data received and tested?
We are going to, let me answer this one, because first of all, we have done a lot of work, our teams together, city as well, and we've done a lot of work over the last several weeks and this weekend. I know my team was working burning the midnight oil to get data input and backlog tests processed and reconciled. We actually added 2,000-3,000 tests on Tuesday. The answer is we've gotten better.
Okay.
However, the backlog will continue, and we're going to continue to have this on an ongoing basis.
Can we trust the numbers from stadium-sized testing facilities?
Can we trust the numbers from the stadium-sized?
Yeah.
Well, those are the ones that generally go off to the national labs. So I don't know what the question is really driving. We know how many tests were done per day, but because if they go to the national labs and then they go to the state, there's a delay. So I think the numbers are trustworthy. They're just late.
Right.
Yeah.
Okay. A DNA company is advertising for your DNA and its impact on your susceptibility to COVID. Is there any correlation currently?
Well, DNA companies are doing a lot of things that, is really evolving science, and really you just have to be careful because we just don't know right now. I haven't seen anything with the COVID-related DNA type of thing, interaction or intersection.
Okay, this is referring to Israel, and it's uptaking cases. It's doing a 3-week lockdown. They're also taking temperatures before you go to the grocery stores. Should we add anything to our current protocols?
This is just a reminder that we are not out of this pandemic, and things will continue to only be dependent on how all of us do our preventive measures.
One last question. Have testing numbers decreased? The answer to that is yes, and we're all concerned about that.
Yes.
Thank you for joining us for our COVID-19 talk with local health authorities. Dr. David Persse, representing the City of Houston. Dr. Umair Shah, representing Harris County. I want to thank you to the Rotary Club of Houston and Kathy Finninger, past president. I am Stephen Williams, Director of the Houston Health Department.